Afternoon, morning. Welcome to everybody. I believe there we go. Except you guys don't want to look at yourselves. Let's move you back over here. Well, hello. Thank you everyone for joining us today. We are really excited to just be able to meet you all today, get ready for the upcoming meeting, hear about your priorities, and hopefully just have a good hour together. So with that, I welcome you all again and just say my name is Tammy Jo Hill and I'm a policy specialist here with NCSL's health team. And before we really get started into the meat of things, I'm going to just kick it off with a quick poll here for you just to get your brain working and your fingers working. So what would your ideal spring break be? It's March. I think if we could all be somewhere enjoying and relaxing, that might be the case, or who knows, maybe you just want to rest at home. So we'll give you a minute to get your answers in here. Oh, we're almost there. You guys are fast. I like it. 29 of 31 have answered. 30, 31. Excellent. All right, let's see where we're all trying to go. It looks like for the majority, laying on the beach. A few want to do a last winter mountain getaway. A little spring cleaning. I like that. That's ambitious. I should do that myself. And then resting at home. I think I'm going to vote as well and say I want one more mountain getaway. Trying to ski one more time, but we'll see how that goes. Excellent. Let's go ahead and close that out. Well, thank you all again. Let's see here. Let me go ahead and advance. So today, we are going to just take a little bit of time to introduce you to NCSL. We're going to hear from our partners at the National Council for Mental Wellbeing. Then we're going to give you a little bit of an overview of the program, things that we've done in the past, prepare you for the April meeting, and then just shout out that we do have an upcoming June webinar. And then we want to hear from all of you. So we will be doing introductions, and I'll give a little more detail once we get to that. But first, though, I would be remiss if I didn't say thank you to the Centers for Disease Control and Prevention for helping sponsor this event and holding collaboration between us and the National Council. So I'm going to take a few minutes here just to introduce you a little bit to our organization and our members, for those of you who aren't familiar. And at the same time, I'll ask those of you who this might be your first meeting with us to shout out in the chat maybe what you're excited for April, or to meet everyone. We just like to know who is brand new to NCSL and introduce ourselves to you. So the National Conference of State Legislatures, or NCSL, is the bipartisan organization serving the nation's 7,383 legislators and over 30,000 staff. We don't take position on state policy, but we are here and do take position on federal policy issues and really anything that is there to help support states' rights. Overall, our mission is to improve the quality and effectiveness of state legislatures, to help promote policy innovation and communication among state legislatures, and ensure that states have a strong, cohesive voice in the federal system. We do this through a number of services, but probably the most common thing that we do is answer information requests. So we have content area experts who handle calls, emails, and work with different legislative chambers every single day. Sometimes we produce information that'll be a little bit more in-house, or other times we will create information or resources that you can share outside, or we will connect with expert organizations as well to help provide their expertise, much like the National Council. So with that, I would actually like to just take a moment, and I'm going to turn it over to my good friend Margaret to share a few words about the National Council for Mental Wellbeing. Margaret, you can take it away.
Thank you, Jo. Thank you. And I'm actually going to keep my video off because my internet is being a little wonky today. So Thanks so much for the introduction. My name is Margaret Jacob Manicki. I'm a Director of Practice Improvement at the National Council for Mental Wellbeing. We also go by just National Council. We are a membership organization based in Washington, D.C., and our members are comprised of about 3,500 community behavioral health organizations, including folks who are providing mental health and substance use treatment services across the country. We have members in all 50 states and U.S. territories, and we're all just working, we are committed to ensuring that all Americans have access to comprehensive, high quality care that affords every opportunity for recovery. So while we're not providing direct services, we are providing services to our members who are providing mental health and substance use treatment services on the ground to millions of Americans who are dealing with mental health and substance use challenges. What we do is we provide a lot of training and technical assistance for our members, as well as advocacy on Capitol Hill, all just working toward improving the lives of people who are living with mental health or substance use challenges. And one of the projects that we do each year that we work with our lovely partners at NCSL on is the Behavioral Health Training Institute, which we'll talk about a little bit. Next slide, please. So one of the programs, one of the big programs that we have at the National Council is our Mental Health First Aid program. Mental Health First Aid is a training, our premier public education program that is provided across the country. More than 2 million, and actually I think this is significantly out of date. I think we're up to 2.5 million people have been trained in mental health first aid, which just teaches, it's a training that teaches the skills to potentially intervene before a mental health crisis occurs, or to recognize the signs and symptoms of somebody who might be developing a mental health challenge or a substance use challenge as well. So we, fortunately, as part of this program, during our pre-conference 2-day training institute that's going to be taking place in several weeks, we will have a 4-hour executive version of the mental health first aid training for you all, so you'll be able to actually see the training firsthand. Next slide. And speaking of our pre-conference training institute, which will be followed by the National Council's wonderful annual conference, we are so thrilled that this year it will be finally in person again. We are just over the moon excited for that. I know several of you will be staying around for conference, which is taking place April 11th through 13th in National Harbor, Maryland, right outside of Washington, D.C. It's the largest behavioral health conference in the world, and it'll be chock full of thought leaders, renowned speakers. I wish I had a list in front of me. I do not, but I will provide a link to our conference agenda. But it is just a really impactful, wonderful experience to share ideas with colleagues, learn about the latest and greatest in, addiction treatment, or the list goes on. We also have a public health track, integrated care, et cetera. So we're excited that several of you are going to be able to extend your trip and stay around for conference. Next slide. And speaking of the pre-conference training institute that we'll have you all joining us for, so we also host the Behavioral Health Training Institute each year, and we each year recruit a cohort of public health and behavioral health officials who you'll be joined with in National Harbor, Maryland. So this year's cohort is our 7th cohort of this training institute. We're so excited. We actually were able to select 50 state, tribal, and local health officials, and they're located across 22 states, many of which you are coming from as well. They are located across all 10 HHS regions. And this year, of those 50, 15 of those are paired team applications that are comprised of a team of a public health official along with a behavioral health official from their jurisdiction. So we're really excited that there's a lot of overlap with the states that you all represent in our cohort, and we'll be kind of doing some intentional matchmaking, if you will, during our pre-conference, so you all can really connect with the cohort members that are located within your state. I think that is all. And so I will pass it back over to Tammy Jo.
Wonderful. Thank you so much, Margaret. And we're really excited to be able to have this conference again and be in person. And, Carmen's going to go into a little bit more detail about our collaboration and our programming. So we're really looking forward to that. But before we do that, I'm going to invite you all to go ahead and look towards your chat. And we just want to hear a little bit from you. What are the priorities or policy areas or things that you and your state are really looking at as it relates to this area? We've thrown a few up on the screen for you there, but if you don't see something that is your priority, please list it. We love to just hear what everyone is thinking about and really focusing on right now. And I would love to shout it out, but I can't see my chat. So I'm going to let you all just do it. And I'm going to let Carmen shout it out here in just a minute. So Carmen, I will just go ahead and then turn it over to you.
Great. Thank you so much, Tammy Jo. I'm Carmen Hansen. I'm an associate director here at NCSL in the health program, and I direct our behavioral health, pharmaceutical, and cannabis policy work here at NCSL in Denver. And thank you again for being here with us and sharing your interest with us in the chat. It looks like we've had a couple of people chime in. Looks like workforce, public health infrastructure, opioids, mental health and behavioral health access for children and families being mentioned. Workforce, especially, that's a long-standing one in many states. So it shows you the diversity of what's going on. So you all can look at the chat and see what folks are interested in, but there should be a little something for everyone at this training. These topics have been top of mind for policymakers across the country for a while, but especially in the last few years with COVID, we've just seen an exponential increase in concerns around behavioral health issues, mental health issues, substance use disorders, things like that. So thanks for showing up with us and sharing your knowledge and being with us to learn more about these important topics. As noted, NCSL works with the National Council to bring legislators and legislative staff to this Behavioral Health Training Institute. So they bring their members to the party, and we bring our members to the party, and it's one big learning and sharing experience. So we're looking really forward to this being in person, like Margaret mentioned. And it's my pleasure to welcome you all to this year's cohort. You were recruited by your chamber's leadership. This is how you got here to attend this, to learn and share with colleagues from across the country. And so you are seen as an expert or as a key decision maker on these issues in your state. So pat yourselves on the back for that. It's an important topic at this time. So we have a great mix of legislators and legislative staff joining us this year. We have 20 legislators and 23 legislative staff, and those represent 18 states ranging from red to blue and some purple in the middle. So that's just how we like it around here. We like to have bipartisan representation at all of our events. So as Margaret said, they are bringing their members of behavioral health and public health officials to the table, and we matched up their attendee list or their members with you all. So that's how we figured out, who to recruit from this year. So hopefully we will have time for you all to meet your colleagues in the other states or in your state to share ideas and just talk about what you're seeing as a legislator or a staff member and what they're seeing as a public health or a behavioral health director. So lots of good sharing and conversations to be had coming up at the meeting. The object of this meeting is to create that shared environment for both groups to learn and learn this latest information. National Council is definitely on the cutting edge of behavioral health services and trends out in the country. So, ideally, we're going to be strengthening your understanding of both the policy side of behavioral health as well as the kind of the service and access sides of behavioral health that the providers really see and the agencies really see. So we'll look at that policy side and the service delivery or the implementation side, so to speak. So you'll see how the policy affects that and how service delivery can also try to inform policy to get those to be better in sync with each other. So more specifically, we're going to be covering issues like the integration of behavioral health into public health systems and services. And we're also going to connect the influence of the social determinants of health on health equity and behavioral health. And we're going to be improving your understanding of integration and potential cost savings and overall population and individual health improvements. Because we know once you can improve the lives of individuals, that improves the lives of the larger community. And also, if you can improve the health of your larger community, that also helps individuals. So it's that symbiotic relationship. And last but not least, again, we really hope you make connections with those directors from your states at the meeting and share your learnings with your colleagues back home once you get there, because knowledge is power, and we hopefully give you enough new ideas and maybe trigger some of your older ideas that you've had that might still be applicable for today when you get home. So the next slide is going to give a little more detail about what to expect, and this will just drill down a little more. These are just some specific topics that we will be covering in the sessions. On Saturday, we're going to have a slightly late start to the day, but we're going to start with an introduction just after the lunch on your own, before we start the executive level mental health first aid training on Sunday. And we're have yet to confirm it, but we're trying to get a room for the legislators and the legislative staff to come and mingle and kind of have an informal meet and greet and chat with NCSL people before that all gets started. So we know some of you are going to be coming in late Friday or early Saturday morning. So if you want to come by and say hi and just start, getting used to being around people again at a conference, please come by. We'll send out all the information on that once we get that settled out. So we'll keep you posted. And so once we have our introduction to the meeting and meet all the folks in attendance, we will move folks into a mental health first aid training. And this is an evidence-based intervention training. It teaches about recovery and resiliency and the belief that individuals experiencing behavioral health challenges can and do get better. And this also uses their strengths to stay well. And you'll be taking the executive course, kind of like a Cliff's Notes version of the full training, which is usually, I believe, an 8-hour training. You're going to get the 4-hour shorter version. But you're going to be learning about the range of risk factors with mental health crises, some of the warning signs for mental health and substance use concerns, strategies for how to help someone in both crisis and non-crisis situations, and where to turn for additional help and support. You are not expected to be the answer for someone as far as, helping them solve whatever might be going on in their life. You're just going to be the one who notices and connect them to some assistance. So don't think you're going to be all of a sudden trained in psychotherapy or anything like that. So we're much more practical than that. So mental health first aid, or MHFA, as we often refer to it, it's diverse and specialized for audiences. So as I mentioned, you're going to be taking like the executive level crash course, but they also have versions for youth, teens, public safety, fire and EMS, workplace, veterans, older adults, rural and higher education. So they have really fine-tuned this program for a bunch of different populations. So it's really relevant in the resources available for those populations that might look different. If you're a first responder versus a teacher, your roles are going to look different in mental health first aid. So you're going to, and a lot of states have started to implement recommendations or encourage the use of mental health first aid, in particular around things like teacher licensing. They're encouraging teachers to be licensed in it, or a few states have actually required it for certain positions for adults in positions of trust. So again, we're just going to get you used to mental health first aid and see how it can apply in your life and hopefully make someone else's life better too. So after we wrap up Saturday, you should find a new friend or an old friend that you know at the meeting and go out and have a great dinner in the DC National Harbor area. And then Sunday we will start, we'll get everyone together back in the same room and start talking about those practice and policy oriented discussions. So things like behavioral health care financing, the opioid epidemic update, roundtable discussions about telehealth, workforce, ARPA funds and how states are using those, and harm reduction and recovery. Those are just some of the topics, but we can't tell you all, can't show you all our cards right now. We got to just, get you warmed up to all this. Then we're going to review some mental health systems changes, including the new 988 national number that's been rolling out across the country that'll be activated this fall, I believe. We're going to have talk about crisis intervention and certified community behavioral health centers. And we'll wrap up with a discussion about children and youth services, which have been, as I mentioned, very top of mind for folks in recent years. So we're going to try to cover a lot of different topics, but get you enough to get your brains cranking a little faster, maybe in a little more advanced on the latest in these topics. So it is quite a diverse lineup, and we hope you're going to learn something about topics you're familiar with, as well as new information to share with your colleagues and connect with your health directors that are there. So we have a nice little map that shows you here on the legislators and staff from the 31 states that have participated in the previous 3 years of BHTI that we've been collaborating with the National Council. And this year, our representation has grown by 5 new states that we're pretty excited about. And that brings us up to 36 total states participating in the program for the last 4 years. And y'all here are represented with the gold little state indicators on this map. And as I mentioned, we have 43 legislators and legislative staff joining us in person, and we're only missing a few of you on today's webinar. So we're excited about that too. Thank you so much for clearing your schedules to take a little time with us. They are, as I mentioned, we're represented anywhere from Alaska and the far, far northwest of the country, all the way over to Massachusetts along the East Coast. And we're also covering from the Canadian border to the north to Texas, the tip of Texas in the south. So we really like having really good representation from across the country at meetings like this. And I'm sure y'all get tired of seeing the same folks, especially after the 2 years, seeing the same faces over and over again. So this will hopefully get you really supercharged up and seeing some new folks. And we will be doing our best to match you up with folks from your state to, again, share information. We may even have you sit together at the same tables. Just so, when you have those little ideas about, hey, do we have this in our state? You can ask someone and they might say, yes, we do. Or I don't know, let me look. So we're really going to encourage you to have those conversations. So that's about it from us for right now. It's enough about us. So let's start hearing from you all. Tammy Jo is going to lead us in some introductions so we can see who all is going to be with us in DC. And go ahead and take it away, Tammy Jo. Thank you, everybody.
Thanks, Carmen, and thank you for the overview. So I will say that we're going to go alphabetical by state. And so I'll just say that really slowly so that my Alaska folks can start to think about their answer for number 3. But the way we'll go is I'm going to call on everyone. Just go ahead and give your name, state, and position, and then either what interested you in the training or why do you want to participate. And really our goal here is 1, obviously we want to meet you, but 2, you all are about to spend a good 2 days together. And we want to make sure that that's fruitful and you can make the connections that you want to make. So make note of the state people they're from that you want to hear about, make note of that person that's got that best practice you can connect with or what have you. That way too, when we come together, we'll be a little more familiar and hopefully we can just really dig in on that Saturday. I will say too, you've met Carmen and myself, but I would be remiss if I did not call out Jessica Hoffman, who I am sure you've seen many an email from and coordinating from, and we just want to thank her. And if you have any questions, please feel free to reach out to any of the 3 of us, but she is our guru here behind the scenes. Okay, hopefully that was long enough for Alaska. So my first up that I would love to hear from is going to be Grace Ellsworth. I'm not sure, Grace, if we can hear you. I think it says you're unmuted, but. This is the life of Zoom. So, Grace, I'm happy to come back to you, or you can start putting it in the chat as well. Sorry about that. Okay, we'll move to your colleague then. Jake Quarstead, I think, is our next person.
Good morning. I'm Jake Quarstead. I am a legislative analyst here in Alaska. And I am particularly excited to learn about what other rural communities have done to implement, I guess, kind of unique solutions to geographic problems. We obviously have a little more extreme in terms of our topography and space between communities here, but I don't think that the programs that other states have implemented would necessarily be something that would preclude us from, I guess, adapting to our own state. So I'm excited to learn from others.
Thank you so much. Up next, we'll have Sharon Everett.
My name is Sharon Everett. I work for the Legislative Council's office in California. I am interested in learning about the realities of the programs. Leg Council, I write most of the law in mental and behavioral health services, but it always helps us to inform our clients when we know what's really going on in the field. So I'm interested to learn what other people are doing and how it's working.
Thank you, Sharon. Up next is Corey Hashida.
Hey everyone, can you hear me okay?
Perfect.
Hey, my name is Corey Hashida. I'm a fiscal and policy analyst for the California Legislative Analyst Office. We serve as, a fiscal and policy advisor to the California State Legislature. We are roughly sort of equivalent to sort of the federal congressional budget office, but we perform those functions for our own state legislature. I cover a variety of healthcare issues for our office, including behavioral health. And so, what I'm most interested in learning about as part of this training is, I think in California, we have a couple of unique structural considerations when it comes to behavioral health, in the sense that a lot of what we do is carved out of the broader structure for physical health, particularly when it comes to Medicaid. And so we're underway on a couple of major state initiatives to try to better integrate physical and behavioral health care. We've also made a couple of substantial state investments in recent years to construct new behavioral health facilities and invest in services for children and youth. And so I guess what I'd be interested in learning about is just kind of like both structurally, like how other states have kind of set up the structure of the delivery of behavioral health services, particularly in their Medicaid programs, and how they've thought about integrating physical and behavioral health care to provide a more like holistic approach to care. Be also interested in hearing about recent state investments and what sort of the most acute issues are by state when it comes to behavioral health service delivery. So those are just a couple of things. So good to be here.
Wonderful. Thank you so much, Corey. And I'm getting word that I believe Grace Ellsworth has, we have figured out technical difficulties. So maybe we'll go back to Grace real quick.
Okay, can you hear me now?
Perfect. Hello.
Okay, sorry about that. Good morning. My name is Grace Ellsworth, and I'm zooming from Juneau, Alaska. I'm a new hire in the Legislative Research Office, and mental health is so applicable to everybody. So I don't know who wouldn't be interested in the training or shouldn't be interested in the training, and to never pass up an opportunity to receive training in pretty much anything. As my colleague Jake said, we live in a remote state. It's got very sparsely populated areas that don't really warrant infrastructure for mental health on a large scale. So I guess just anything that I can learn is helpful, and especially as it applies to us. Thank you.
Thank you so much, Grace. All right, we'll jump back down to California, and up next will be Mark Newton.
Yes, hello, everybody. Mark Newton from the Legislative Analyst Office in California. I'm a colleague of Corey's. I oversee a team of health, developmental services, and technology analysts at the LAO. Very, very interested in this training institute in California. Behavioral health generally is a very top of the list budget and policy priority for the legislature, as well as public health. COVID-19 has certainly brought to light sort of the deficiencies in California's public health system, and just a lot of gaps. And I think this issue of the integration of behavioral health and public health is really important. So interested to learn in that. Corey mentioned a number of initiatives in California. One other, just to add to what Corey mentioned, is sort of the integration of behavioral health and homelessness policy. This is sort of rather new in California. It's a big policy challenge, and very interested in what other states are doing in that area too. So really look forward to learning a lot and sharing what we're doing and learning from others. So thank you.
Thank you, Mark. And then up next, we have Representative Judy Amabile. I know not everyone could make it, so I'm going to give a pause, but then also back just in case you get to hop on later. So up next, we'll go to Amanda King.
Hi, I'm Amanda. Can you hear me?
Perfect.
Great. Yes, I'm Amanda King with the Colorado Legislative Council staff. I'm a senior research analyst, and I staff the House Public and Behavioral Health and Human Services Committee. So I think just by the title of my committee, you can understand why I'm interested in this conference. But specifically, I'm very interested in the mental health first aid component of it. I've been wanting to take that training for several years, and I appreciate the opportunity to finally get a chance to do that. And much like Mark, I think that I'm very interested in how other states may be looking to address the connection between homelessness and mental health issues, as well as workforce issues. So.
Thank you, Amanda. Up next, we'll have Representative Daphna Michelson-Janae. She is our other Colorado representative. My guess is it may be a busy Friday over there, so we can come back to those folks. Up next, we'll go to Representative Tammy Exum.
Good afternoon. Thank you so much. I'm Tammy Exum, representative from Connecticut. And I am really interested in this training because as many have spoken about before here during COVID, we really noticed the increase around children's mental health in general, but particularly around children's mental health has become a priority and focus of mine and so many within the legislature, and it has certainly become a priority of our speaker. And so I was asked to lead a bipartisan working group, and we've really been focusing on children's mental health, and so many of the priorities that will be covered in this conference really align very nicely with the type of work that we're doing. So I'd love to see and benchmark off of what other states are doing, especially when it comes to some issues around insurance, and just seeing what other models look like. I've heard about the first aid training, so it'll be really good because we're considering something similar to that when we look at ways to roll out different types of opportunities to support kids with and rolling out programs into the schools and different other areas that might be able to apply a first aid type model. And so I'm really just interested in benchmarking and learning from everyone. So thank you so much for this opportunity.
Wonderful. Thank you so much, Representative. Up next, we'll go to Representative Mary Wielander.
Good afternoon. Thank you for having us. My name is Mary Wielander. I'm a rep from Connecticut. I am very grateful to be working with Rep Exum on the mental health working group. My focus has been for a while on children's access to mental health. And one of the things I would love to hear at the conference is how other states are integrating this type of service and care into our school systems. and specifically how we can make a better connection between mental health services and behavioral health services and suicide prevention. So looking forward to hearing how other states are looking at the 988 rollout, and any potential state suicide advisory boards, feedback type of things. So I look forward to having these conversations, and thank you for having us today.
Thank you, Representative. Up next, we'll have Representative Deb Conroy. I'm sorry, Representative, we might be having some sound difficulties here. Looks like you might be unmuted. I'll go ahead and give you a moment. Maybe we can come back. If not, please put your information in the chat, but I'll make a note here to come back. Sorry about that. Let's see here. And then it doesn't look like he was able to join us today, but we do also have a Representative Thaddeus Jones from Illinois as well. So hopefully we will get some introductions come April. So next we'll jump to Kelly Mead.
My name is Kelly Mead. I am the HR director for the Indiana Legislative Services Agency. I'm sort of looking at this issue from an employee-employer perspective. In the past couple of years, as was mentioned, mental health has been more of an issue than it's been in my 30-year HR career. I'm very interested in the mental health first aid training and coming away with maybe some techniques to better serve our staff.
Wonderful. Thank you, Kelly. Up next, we'll have Senator Ralph Alvarado.
Can you guys hear me okay?
Oh, there we go. Yeah, hello, Senator.
Right. How are you? So the Ralph Alvarado State Senate, serve in Kentucky. I'm the chairman of health and welfare here. So always interested in getting ideas, concepts from other states as far as where things are going on. Our biggest issues here are workforce shortage issues. So I'm always interested in that, trying to develop better infrastructure. Like so many states, I think all that's been identified. We've also had a, during the COVID crisis, a 49% increase in drug overdose deaths here, which I think a lot of states have realized as well. So, and we just finished up with a severe mental illness task force also to look at what we got to do to try to identify some of those problems. So always interested in concepts, see what other states are doing. And whenever I get an invitation from NCSL, I try to respond. So to make sure that I can participate, it's always a lot of good information that comes out of that.
Thank you, Senator Alvarado.
You.
Look forward to seeing you again here in person soon. Up next, we'll have Representative Kimberly Moser. She may also not be here. I hate to go too fast. I will come back in the end. Senator John Cronin is next.
Hey everybody, how you doing? I'm sorry to be calling in from the car today, but very excited to be joining this cohort in DC. State senator from Central Massachusetts in my first term, and really excited to have some good discussions about workforce challenges and inadequate reimbursement rates, which are really the two big challenges that we face in Massachusetts. And also kind of put those two challenges in the context of opportunities for investments in workforce through ARPA funding. We got a little bit more than $5 billion in ARPA funds at the state level. We've committed $400 million to growing the behavioral health workforce and addressing the crises that we're seeing in our emergency departments and outpatient services. And we've got $2.3 billion that the legislature plans to spend and allocate by the end of the year. So making some historic investments in workforce, and hope to have some good conversations and share best practices with other states. So thank you.
Well, thank you so much, Senator. Sorry you're calling in from the car, but do appreciate the dedication there. Up next, we'll have Colby Dillon.
Hello, everyone. I'm Colby Dillon, Senior Policy Advisor and Counsel to Senate President Karen Spilka in Massachusetts. Really looking forward to attending this training. As Senator Cronin already said, addressing behavioral health, public health needs for the Senate President and the Senate in Massachusetts is a huge priority. What I'm really looking forward to hearing, I'm looking forward to hearing everything from all of the states and different approaches that folks are taking, but also particularly interested in hearing maybe some creative ideas from folks to get culturally competent workforce to increase access to care for folks across the continuum, as well as some ideas for increasing access to crisis intervention services and some prevention services.
Wonderful. Thank you so much, Colby. There's a good workforce theme that seems to be emerging. So hopefully we can absolutely connect on that. Up next, we're going to have Elizabeth Gans.
Hi, can you hear me?
Yes, wonderful.
All right. Hi, I'm Liz Gans. I am Chief of Staff and Counsel for State Senator Julian Cyr, who represents the Cape and the Islands and is also the Senate Chair of the Joint Committee on Mental Health, Substance Use and Recovery. So, and I am the lead staffer with him on that work. So I work closely with Senator Cronin and with Colby. And so, yeah, as Colby said, and as Senator Cronin said, like, we're just interested in these issues sort of across the board. And I would echo all the things that they said. I think I have a sort of personal interest in the 988 rollout and how to do that effectively and how other states are making that happen. So looking forward to the conference.
Wonderful. Thank you so much. And then I know we also have a Senator John Vilas from Massachusetts, but I don't think he was able to make it today. So hopefully we'll get some introductions in April from him. So next we'll jump to Ellen Ackerman.
Hello, I'm Ellen Ackerman. I work for the Michigan Senate Fiscal Agency covering the Department of Health and Human Services budget, along with workforce development that other people have mentioned, specifically development and retention in rural areas. I'm very interested in how other states are providing substance use disorder services, specifically to homeless people in their state.
Wonderful. Thank you so much, Ellen. Up next, we'll have Kevin Kustra.
Good afternoon. My name is Kevin Korstra with the Michigan House Fiscal Agency. I have a similar role as Ellen. I am interested in learning more about other state strategies to integrate and coordinate care and financial provision of mental health, as well as strategies to limit the reliance on emergency departments for crisis services.
Wonderful. Thank you so much, Kevin. I know that we also have a Senator Michael McDonald, who is from Michigan and not here, but you know, we'll see you in April. Up next, we'll have Elizabeth Ribby.
Hi, this is Senator McDonald. I was able to get on.
Oh, sorry, Senator.
Sorry, I missed the first little bit of it, but no, I appreciate being on. I'm very much looking forward to the conference. My doctoral degree was in healthcare administration. My dissertation was on obesity, and I had found within the study that there was just as much of a psychological component as a physiological one. So this is something my colleagues in Michigan know is right up my alley. So looking forward to it.
Wonderful. Thank you so much, Senator. I'm glad you could join us today. And I apologize. It is Elizabeth Ribby Shiles, I think, is next.
Hi there. It's Liz Ribby Shields. I'm one of the drafting attorneys with the Legislative Services Bureau, and I am interested in hearing how things are working in other states, particularly with some of the programs that are being implemented with healthcare shortages and the opioid epidemic.
Wonderful. Thank you so much, Elizabeth. Representative Mary Whiteford.
Yes, hi everybody. Sorry I'm late. My mom's been sick. So I'm just catching up with what you guys are talking about.
Yeah, thank you so much. And I'm sorry to hear about your mom. We're excited to have you join us in April. We're just doing quick little introductions and what you are interested in for this program.
Oh, thank you. So I have been serving for 6 years. I am chair of our Health and Human Services budget, as well as being on health policy. And one of my most important issues that I've been working on is making sure that we have behavioral health access, early intervention, early access, especially for children. And so I'm really curious what other states are doing around the nation.
Wonderful. Thank you so much for joining, Representative.
You're welcome.
We'll have Senator John Arch.
Thank you. I chair the Health and Human Services Committee here in Nebraska. You may not be aware, but we are a one-house legislature, unique in the nation. But so we have one HHS committee, which I chair. I have worked for Boys Town for the past 27 years, so I'm pretty familiar with children and adolescents. We recently did quite a bit of work with telehealth in Nebraska. I'm interested if we've missed anything and be sure and add to that. We obviously have workforce issues as well. And then in particular, I'm interested in adult chronic care, how other states are handling adult chronic care. So I'm looking forward to the conference. Thank you.
Wonderful. Thank you, Senator. And then up next, I'm not sure if she was able to join, but we have Assemblywoman Angelica Jimenez from New Jersey. Wonderful. Well, we'll meet her in April. Up next, we'll have Justin Lucero.
Hey everyone, I'm Justin Lucero. I work for the New Jersey Office of Legislative Services in our Human Services section, and I help committee aid for the Senate and Assembly Health Committees. I'm particularly interested in how different states are using and delivering behavioral health services through telemedicine and telehealth. I'm also interested in the 988 rollout and seeing how different states are structuring their crisis response systems. And then I think in our committees, we've seen a lot of legislation on supporting people with substance use disorders and seeing how different states are maybe innovating in different ways to address the opioid epidemic.
Thank you, Justin. I've also gotten word that Senator John Mannion is not here, but he is from New York, so looking forward to meeting him. So up next, we'll jump to Emma Carroll.
Hi, I'm Emma. I work for Ohio's Legislative Service Commission. I draft and do research for the Health, Human Services, and Medicaid group. So really what I'm trying to get out of this is a sense for what other states are doing in terms of legislative approaches to behavioral health, just so I can get a sense of what I might be drafting, what I might be doing research on, and also trying to get some broader context to help me as I'm fulfilling those requests.
Wonderful. Thank you, Emma. Up next is Representative Jim Gregory.
Good afternoon, everyone. Jim Gregory, State Representative, Republican in Central Pennsylvania. Really looking forward to the opportunity to learn a number of things. I chair the Pennsylvania Legislative Addiction Recovery Caucus in our House. And I ran with the idea that I'm in long-term recovery, 12 years, and also prime sponsor a bill that deals with the 2-year window for folks that timed out from the statute of limitations in Pennsylvania, to give them a 2-year window to sue civilly. So I've had a lot of experience dealing with folks that have the ripple effects of child sexual abuse, but also addiction. And what I'm looking forward to is hopefully getting some direction, some advice on how to advance what I believe we should be using some of the opioid settlement money for, is expanding 30 days of recovery to 90 days, both for the person in addiction as well as the family, to give them that 90-day window as well, to get better. But also mobile mental health teams in Pennsylvania. How can we do that? How can we make that happen? So I think those are probably the things I'm looking forward to being able to share, but also learn from the folks that are attending. So thank you very much for having me.
Wonderful. Thank you, Representative. And I believe your colleague, Representative Carrie Lewis Del Rosa, will also be joining us, but I don't think she is here today.
Okay.
Next, we'll jump over to Senator Billy Garrett.
Thank you very much, all. I look forward to meeting each and every one of you. I'm a state senator in South Carolina, and I'm on the Medical Affairs Committee. And we've got a horrid opioid epidemic crisis going on here in South Carolina. We lost 49 people in my county in the last year to overdose. So I'm interested in programs, unique opioid addiction programs that deal with assessments, treatment, life care, long-term care. And I was very interested in the earlier Representative Gregory. He was talking about some mobile mental health. That sounds extremely helpful, and look forward to working with all of you.
Thank you so much, Senator. And I would be remiss if I didn't call out your beautiful bookcase that you have behind you.
Thank you.
Up next, we'll hear from Sarah Hurd.
Hey y'all, I am also in a car, but I am and I am the budget analyst for the healthcare subcommittee of the Ways and Means Committee in South Carolina, as well as the general government legislative analyst for bills that go through our committee. And I am really looking forward to the mental health first aid training. Obviously, we have a huge workforce issue in South Carolina. I think we're 600 nurses short at our Department of Mental Health alone in our capital, Columbia. And then a huge topic is the potential to break apart and reorganize both our behavioral health and our mental health agencies. So I'm really interested in hearing what other states are doing that's working, what y'all have done that hasn't worked. And one thing I'm really proud of in South Carolina is our telemedicine and telepsychiatry program. So if y'all have any questions, happy to share ideas with y'all.
Wonderful. Thank you, Sarah. And I absolutely bet people, even myself, will take you up on that. So appreciate it. Up next, we have Amy Lazenby.
Hi, I'm Amy Lazenby. I am a researcher with the South Carolina Senate Medical Affairs Committee. I work with Senator Garrett, who you heard from earlier. I am similar to his interest. I'm interested in behavioral health and substance use disorder in particular, very interested in the opiate addiction issue. That's a real problem in South Carolina. I am also interested in recovery policy, especially harm reduction strategies, and how these programs are funded and implemented in other states. And as my colleague Sarah from the House in South Carolina mentioned, we are legislation is in place in South Carolina to begin the breakup of our environmental and public health agency. And there's going to be a lot of consolidation of some mental health and substance use disorder agencies. So I'm curious how other folks have done that in other states. And I'm really looking forward to the conference in April. Thank you.
Wonderful. Thank you, Amy. My apologies for fumbling your last name. Up next, we'll go to Georgianne Martin. Feel like I'm on Jeopardy. I think I saw her earlier, but also from Tennessee. Oh, there we are. Hi, Georgianne. We'll give you a moment here to get settled. See if I can help you unmute.
Yeah, can you hear me?
Wonderful.
You can?
Yes.
Okay, wonderful. Yes, Georgianne Martin, Tennessee. I'm a budget analyst, and our staff supports the House and the Senate. We're a joint staff. So the opioid is an issue here as well as fentanyl. We're seeing a lot of fentanyl cases. And one thing that interests us is I think all the states are getting a lot of federal money through CARES, CRF, FSAG, all this pandemic money, labeled different ways. But, and for the most part, we're trying to expand some of our programs and continue some programs that were on the verge of expiring type thing. But how is everyone looking far into the future for these programs? This money's going to run out. It's non-recurring money. So if you do expand programs, or if you do some big projects, then what happens once the money's gone? And how are the states coping with that? And with the pandemic ending and things are circling back around, and kids are getting back in school, and people are getting back to work, there's still anxiety about, some people still don't have jobs, or they've taken jobs at lower pay. So how long do we foresee that we're going to have to try to deal with anxiety and depression and all of this post-pandemic type things? Because a lot of people are right on the verge of bankruptcy, or right on the verge, they've lost family members through all this that were part of their financial base. And so, yeah, just what are we doing post-pandemic would be very helpful.
Absolutely. Thank you so much. And I think you raise a number of questions that hopefully we'll get to in the meeting, and we have resources on, but definitely that sustainability piece, I think, is a question many folks are looking to in the next few sessions. Well, I know, and I'm going to just take a quick pause. I know that we're almost at noon, and so I just want to say thank you all for joining. We only have a few more folks to introduce and then a few resources. If you do need to jump off, please reach out to Jessica Hoffman, myself, or Carmen if you have questions regarding travel or that's coming up, but we'll dig into that here in just a minute. I do know that we are also missing today Senator Page Wally. He is also from Tennessee, and we look forward to meeting him in that time. So next we'll go to Nicole Delaney.
Hi, I'm Nicole Delaney. I work with the Legislative Budget Board in Texas, and I have a particular focus on the budget related to health and human services and behavioral health in particular, not just within health and human services, but across all state agencies. And what I'm really looking forward to in this meeting is hearing more about how other states finance their behavioral health systems and the various different programs, including a lot that have been mentioned here, such as workforce challenges, 988 implementation, inpatient psychiatric care is a big topic in Texas, and then also the intersection of criminal justice and behavioral health. Thank you. I'm excited for this.
Thank you, Nicole. Up next, we'll hear from Claire States. I practiced your last name and I just messed it up, and I apologize. I'll just let you take it away from here. Oh, Claire, we might need to unmute you here.
Okay. Unmuted?
Perfect.
Perfect. A lot of people mess up my last name. It's totally fine. My name is Claire Stieg. I'm a colleague of Nicole's at the Legislative Budget Board here in Texas. We help the legislature throughout the legislative appropriations process and our biennial cycle. And so I'm really looking forward to learning more about this topic and just to help us support the legislature throughout that process. I'm specifically focusing on Medicaid and CHIP through my assignment, and so looking forward to reinforcing how states are financing behavioral health through public systems, and then also through their state support.
Wonderful. Thank you for joining us, and thank you for the help there, Claire. Next we'll have Julie Tran.
Good morning, everyone. Julie Tran. I staff the Senate Health and Long-Term Care Committee for Washington State. I'm a nonpartisan research analyst, and I just finished my first session with the Healthcare Committee, and I'm really excited to be at this training for all the reasons that everybody had already discussed, but also because I'm really new to the policy area. I'm really interested to learning from everyone as well as from the presenters. Thank you for the opportunity.
Wonderful. Thank you for joining, Julie. I know your colleague, Christopher Blake, will also be joining us from Washington, but I don't believe he's here today. Okay, perfect. Just wanted to make sure. Up next will be Jonathan Cook.
Good afternoon. My name is John Cook. I'm a legislative attorney with the Wisconsin Legislative Reference Bureau. The LRB drafts every bill that's introduced by the Wisconsin legislature. I specialize in health and occupational licensing, so this institute covers a lot of subject areas that I'm interested in professionally. So I'm really interested in learning all the different programs that different states are working on and all the different ideas people have.
Wonderful. Thank you, Jonathan. We'll go to your colleague, Stephen McCarthy.
Hi, everyone. Steve McCarthy, Wisconsin Legislative Council staff, a number of related committees in our legislature on health and mental health, and work closely with Jonathan frequently. So looking forward to seeing everyone, kind of learning some of those success stories from other states and sharing some of the novel approaches that legislators have been interested in pursuing in Wisconsin. Workforce, crisis response, suicide prevention, rural areas and in particular, there's a lot of interest. So really looking forward to this meeting in April.
Wonderful, thank you. And I believe your colleague, Scott Craig, will also be joining us, but it doesn't look like he is on right now. So that makes us through the alphabet, but I'm going to go back. I know that we want to see if we can hear from Representative Deb Conroy. And she might have had to hop off. That's okay. She's from Illinois, and be a pleasure to meet her in April. I think I saw Senator John Mannion, New York, join.
Hello, great to see everybody and looking forward to attending here. And I guess we're pretty close to a month away, right? So anyway, John Mannion, I represent an area of Syracuse and the surrounding area. I'm a fairly new senator. I'm 1 year in, and I sit on multiple New York State Senate committees, but I do chair disabilities, and that is really what will bring me to this conference. My colleague, Summer Brook, who chairs mental health, and there was a time right before we took office where the Committee on Disabilities and Mental Hygiene was what it was called. So as we took office, we have a great leader in Majority Leader Senator Andre Stewart Cousins, who has decided to split these committees, which we believe is the right move, particularly as the issues in both of those worlds are pretty important. So the only thing I will say is that Senator Brook is she's expecting to have a baby during that time. So you're stuck with Senator Mannion, who will be involved. I'm not quite as well versed as Senator Summer Brook on mental health issues, but of course, in New York, we call these the O agencies, which they all start with office. So we do have a lot of overlap, but I'm very excited to attend and appreciate the opportunity to learn more. Again, many of the issues that I deal with and have more of a deeper dive on are disabilities related. And we do have, as you can imagine, a tremendous workforce crisis in that world in New York State. But thank you for giving me the time to talk, and certainly excited about participating. I unfortunately am in the midst of the New York State budget, and there will be additional briefings today. So I probably will break away early and probably will break away unexpectedly.
Well, thank you for joining us, Senator. It's great to meet you. We look forward to seeing you in April and wish your colleague all the best with her expected new joy. But I'll just shout out again, if you do have questions, Senator, about travel or anything as it's coming along, please feel free to reach out to Jessica Hoffman. She can help get that information to you should you need to leave. And then the only other person I believe I've heard is actually on, and I apologize, is Christopher Blake. So I'd like to go backwards to Washington and see if he would like to say a few words.
Hi, yeah, I'm sorry. Apologies to Amy Lazenby. Somehow I'm appearing as her from South Carolina, but I'm on the other side of the country in Washington State. I'm Chris Blake. I'm staff to the council with the House Healthcare and Wellness Committee. So I'm like Julie Tran, and I'm on the other side of the sundial, as we call it. And I'm nonpartisan staff over here. And I guess, yeah, I'm interested in hearing a lot about, we did some revamping of the 988 system a few years ago. It was in 2001 with the 988 funding opportunities. We passed what was supposed to be just a simple funding bill, and it kind of really blossomed into something much more. And we've been talking, there's a lot of discussion about Georgia and Utah and what they've been doing. And so, yeah, I'd just like to hear from other states and see what they've been doing, because we're still put a lot of money into it, but there are a lot of work groups that are trying to sort out exactly how this is gonna look. So that's kind of my main interest there.
Excellent. Well,
And apologies to Amy.
you make a lovely Amy or Chris, either way. Appreciate you. And I'll just pause here just to give anybody I may have missed or joined late to go ahead and give your introduction. Well, wonderful. We're all really looking forward to meeting all of you. And with that, we've got a closing few reminders and notes. So I will turn it over to my colleague, Carmen.
Thanks, Tammy Jo. Yes, one quick thing to close everybody out, reminders and resources to wrap things up for today. As we've noted, Jessica Hoffman from our fabulous team will email reminders about everything you need to know. So please keep an eye on your emails. We do also have a 2022 cohort webpage with dozens of resources from the National Council and NCSL. You may find it useful just to look this site over just to see what's available and might be of interest to you. Lots and lots of background on service delivery and things like that you're interested in. So we'll send that link out as well. And regarding lodging and transportation, we recommend, if you haven't already booked your flight, flying into Reagan National Airport or BWI in Baltimore, please make your flight arrangements as soon as possible if you haven't already. If you need to make any changes to your flight, please go do that through the Christofferson travel portal, either by phone or online. And Jessica will be sending out hotel assignments very, very soon, as soon as we can get those. And if you have any other travel questions, contact Jessica, and because she's our travel guru. And we will also be having a webinar in June on the 15th, 10 a.m. Pacific, 1 p.m. Eastern, or 11 a.m. Mountain Time if you're like us in Denver, and additional content and we'll have additional content and discussion. So just stay tuned on that. A lot of it will be developed after this meeting. So we're excited just to have another opportunity for you to learn and share. So I think that's it from us. If you have any questions, please chime in now. And thank you all for joining us. We will see you in DC. And again, the slide we show here is just a list of resources, and we will share this link out with you so you can click on all those links and see what we have. And we have a lot coming out on mobile crisis units. I put one link in the chat, but we have more things coming out. So for any of you interested in that, we encourage you to click and check it out. Thank you so much for attending. Thanks, Tammy Jo. Thanks, Jess. And thanks for all the attendees for joining us today.
Thank you.
Thank you.
Bye, everybody.